So for more on this, we want to bring in immunotherapy scientist and medical expert, Dr. Leo Nissola. Doctor, we heard this really another dire number. It's a projection. 150,000 more Americans could die by February. And when I hear a number like that, it's even though we know a vaccine is on the horizon, it's kind of disheartening. Is that number inevitable? I mean, are we losing this?
Good morning. Thank you for having me. And I wish I had something else to say. The statistics are shocking, as you know. We have over 100,000 people hospitalized with COVID in the U.S. And out of those, 20,000 of those cases are requiring to stay in the ICU, while over 9,000 of those cases are requiring ventilators. So the number of cases are alarmingly high, and I'm afraid that the winter ahead of us, things gonna get worse. We knew back in March that if we did not contain COVID, things would get worse, and now with the winter ahead, things are not looking pretty. So I'm afraid that December, January, and February are going to be rough.
I know we've gone over this over and over again when we've talked to doctors, we've heard from the CDC, but in order to bring that number down between now and February, what do you want to see people doing?
Well, countries that have successfully contained COVID, they did so by allowing contact tracing, free and ample testing, and compliance to those public health measures that we know work, like mask wearing and social distancing. Now, in the U.S., we have a challenge with a low public acceptance of contact tracing efforts. And for that reason, I think we should focus on rapid testing. We should allow COVID testing at home without the need for a doctor's order. And I do think that because if folks are allowed to get tested at home, we will be able to identify those outbreaks, and people will not leave their homes in case they test positive.
You know what I like about your answer there, Doctor, is we've heard about sort of the various pegs to attack this pandemic, and that contact tracing is really important. But you kind of gotta deal with the audience that you're dealing with, and if people are not willing to comply with contact tracing, if they're not gonna, answer the questions when they get that phone call, then you got to pivot to the next best thing. And people seem to certainly be open to testing. Maybe it has something to do with the messaging coming from the White House, because that for the longest time is what they were doing at the White House, is kind of like their primary protection against the virus. Didn't work so well, but it is a very important tool. But I want to ask you, you're in California. California is breaking all kinds of records. Recorded the highest ever daily number of cases at more than 20,000, I think, yesterday. What's happening in California? For the longest time, us here on the East Coast, especially when the first wave was coming through, I was looking at the numbers in California, and they had been low for so long, and now it seems like a completely different story. What happened there?
That's right. And I think the U.S. Overall has experienced a third COVID wave. And, that calls for people to exercise more caution and to reduce their exposure to the virus. I think, COVID fatigue is real. And, people have been locked up inside their house for almost a full year. And I think, the weather here is beautiful. So I see a lot of people going outside. So that will, higher your chances of getting infected and coming across the virus. And I think California is experiencing an outbreak because cases are exponentially growing, but also people are getting together. And, with the holiday season and Thanksgiving, we saw a lot of people literally just not following the social distancing rules and dining indoors, for example. And that's something that we should not do at this time.
Yeah, we're still, waiting for the full impact of all of that Thanksgiving travel, the full impact of people trying to get that last, restaurant meal in before there were many restrictions imposed. And we've been doing a lot more stories on the healthcare workers, how exhausted they are, both physically and emotionally. And it doesn't look, like you point out, for the rest of the holiday season, they're going to get much of a break. Beds are full. Some hospitals are fearful they will run out of ICU beds. what do hospitals need to do to prepare for what could be coming? Does it mean more, makeshift, I don't know, hospital wings, or, what's your best suggestion?
You're right. Things are not looking good, and I believe that the U.S. has never experienced this kind of stress in the healthcare system in its history. In talking to my colleagues who are in the front lines, they are worried and overwhelmed as well. I think at this time, government officials, health officials, and state authorities should be looking at resources that they're going to be needing in order for them to be able to service the population that gets sick. You see, the CDC has just shortened the guidance of self-quarantining, which I think it was a good idea. But states like Tennessee, South Dakota are already on the brink. They already have 95% of the ICUs used. California, that number is not that bad yet, but I'm afraid that by January 25th, these numbers are going to be higher. So I would call for bold and decisive action from leaders at this point.
Yeah, I think it's all really good advice. I think it's good advice for individuals too. Take matters into your own hands in terms of your health. If you hear from your health department, restaurants, indoor dining is closed in your area, and you look across the street and you go, well, they can dine indoors. There's a reason. Maybe the cases are spiking where you are and not yet across the street, but it could happen. It could happen, in a few weeks from now. So I think there's a certain amount of just sort of logic when it comes to combating this. There is a vaccine on the horizon. It's not here yet, though. So I think if we all kind of do the right thing, we can hopefully see a better spring. Dr. Nissola, thank you so much.